therapeutic treatment, not of the mainstream medicine. Basically, anything that can help anybody that is not classified as medicine.
So if you aren't happy with the biomedical part of medicine, or if you have a different belief system, there's an alternative path that you can use that should be able to alleviate most of, if not all, the problems and be able to line up side by side with the biomedical treatment.
Any form of medicine that is not according to the westernized criteria of what they define medicine as.
Westernized would be what you would see in a traditional hospital. If someone is sick, they go to a hospital, they go to a clinic, and you have a nurse or a doctor or a dentist or a clinical associate attend to you.
Anything that doesn't fit into the mainstream idea of the type of people who work at a hospital or a medical practice. Anything that's not the Western idea of what a medical practitioner is.
Any channel of health seeking, health service that isn't to do with science, with Western science.
Traditional medicines,
Reflexology,
Body talk,
Chiropractic.
Yoga.
Crystals,
like Reiki,
homeopathy,
acupuncture,
Chinese.
a lot of homeopathy. I used a lot of homeopathic medicine as a child.
I had a patient who came in with severe renal failure and had subsequently gone for alternative medicine consults. And we worked out what was given to this young child, I think there were 4 months or so, was a concoction of bleach and sunlight soap or something with that regards within there. The patient subsequently demised.
Personally, no, I haven't experienced any form of alternative medicine. In the ward, you would see patients that tell you that they've been through a traditional healer, they were given some herbs, and you hear people talking about, using remedies that their grandparents have been using for years to treat all kinds of disease and to prevent all forms of illness from happening. So yeah, in that format, I've experienced that.
I honestly have, because with traditional healing, it's more of a spiritual treatment than it is a medical treatment. So at the time, it was what I really needed.
If I got to my wit's end and I hadn't had any success, if I had someone else who'd strongly recommended something different, maybe I would try something.
I think I'd go to a traditional healer. I think more for the experience than anything, and just try to see what it's like. But I think I've been brought up in a very westernized type of way, where I think I'd be more comfortable going to a normal doctor.
in South Africa, from personal experience as a nurse, it plays the biggest role. I think it plays a bigger role than actually mainstream medicine, because most people, that's their first line of treatment before they actually go to hospitals and clinics and all of that. And for the fact that it's not actually recognized as, I don't know, therapeutic, for lack of a better word, it's actually sad. Yeah.
I feel like the stories that we hear are quite negative. Like, I've pretty much only heard negative things about chiropractors. I'd really like to know more about traditional healers. I think traditional healers can be really positive influences, and I think they're really important in the South African medical system.
Our grandparents grew up, believing that was what kept them healthy, and it did keep them healthy. So I think we need to incorporate that when we're dealing with a patient, understand that when someone walks in, they're not just a disease, that they have a background, they have beliefs, that they have culture and things that they do outside of the hospital. When you see them in the hospital, you're seeing them for a glimpse of what their life is really like, and we need to take that into consideration. And I think there's a strong cultural component associated with it.
I definitely think Western medicine is not researching enough into alternative forms of medicine, but until I've personally seen studies about it and seen comparative evidence, I'm hesitant to use or prescribe alternative forms of medicine.
So I think it's incredibly important for medical practitioners to be aware of alternative medicine, because most of their patients will be using them either before, during, or after their encounter with the medical practitioners. But I don't believe that they should be integrated. I believe that they should work in their own lanes, but are aware of each other and use each other as sources of holistic care patients.
Westernized doctors should be open to the fact that their patients are seeing other forms of alternative medicine and should try and incorporate it into their treatment. I think where things go wrong is when both forms of Westernized medicine and alternative medicine try to separate their forms of treatment. I feel a patient get a more holistic treatment and a more effective treatment if doctors are open to incorporating
South
both.
Africa, we don't have enough doctors. We don't have enough healthcare providers in all sorts of areas. And for example, with our traditional healers, they're already in the communities. They have the trust of the community.
I think there should be. I think it's gonna be difficult because it's such a broad spectrum to bring everyone together. But I think it's very important that it should be something that is in some form of way attained.
I think that it would be good to incorporate some the types of different alternative medicine and westernized medicine in South Africa, especially given the cultural history and the traditional medicine and the alternative medicine sector that we already have.
We've got to remember that each individual human being is different, and the same way as our anatomy in our bodies is not exactly the same from person to person, we don't all react the same way, and some medications will never work for some people. And I think sometimes we have to be open to the fact that maybe science hasn't discovered everything, and we're constantly on a road to find out new things. And I think we need to keep our eyes open and realize that sometimes this alternative medicine may be the future solution.
They have worked for a very long time. I mean, in our South African context, especially the Black community, for a long time there wasn't westernized medicine, and there was alternative medicine which was working so far. So I feel like some families and some people are still adopting those methods, and because it's working for them, I think there is a way to bring them together.
I know in France, for example, what happens is that pharmacists especially learn about traditional medicines in their career, as well as they learn about nutrition and first aid, in addition to pharmacology and prescribing westernized medicine. And they can prescribe alternative medicine as well as westernized medicine together to help heal a person's ailments. And also in the hospitals and in different medical schools in France, alternative medicine is taught to the physicians and the medical students, and you'd find that the physicians try and incorporate allopathic and alternative medicine forms along with the westernized medicine forms to help the patient heal.
It's very important that the biomedical side of students learn about all the different alternative medical paths, especially if they get a patient one day who's from some rural area or something like that, and this is what they've been through. You can understand exactly what they've been through and how to work with that, as opposed to disregarding it and doing your own.
Yes, I definitely think we should be educated, because I think ignorance sometimes creates fear, and that's not conducive to learning. And in a scientific field, the more you know, it can only help you in the future.
I would be very much interested in learning about it, especially being a doctor. And in the South African context, a lot of people do seek alternative ways of health prevention and curative measures before they come to the doctors. So knowing that, I feel like would help me in treating my patient better.
So I think knowing the more common herbs and the more common form of treatment that patient receive can also help you as a more non-alternative health practitioner to deal with your patient better.